Hi, my name is Hank. I wanted to take a second to discuss a current issue that I am experiencing with a specific VA hospital, but to my understanding, it is a common issue throughout the VA hospital system. The one thing that gets me is the fact that this exists, and it is through a system where I have earned the right to the treatment through the VA hospital. I guess it's important to go through my situations specifically in regards to, I apologize for the disruption. I'm trying to align this so that I can continue driving and talking because this matter weighs heavily on my mind. Back in 2016, I was hospitalized for a hernia. Now, give a little history on my hernia issue. My first hernia was back in 2007. I was treated for, and to repair the hernia, the hospital, the VA hospital or military hospital out of Portsmouth Naval Hospital, was the one that initially made the repair, and they placed a piece of mesh that was faulty. To my understanding, the mesh itself was similar to the material that is also used on screen porches and such. Now, I understand that it's not just the bare raw material of a screen, but it has the type of material that is consistent to a screen, which would act like a piece of sandpaper. I don't want to just continue to mumble or ramble. I'm kind of upset, and I apologize for the way that I sound. It's hard to gather my thought, and I guess I should have thought this through more thoroughly. But in 2016, I went back in because there was complications with that piece of mesh. To my understanding, in 2016, the VA hospital was supposed to remove that piece of mesh and the affected tissue from the damage of that mesh, which was supposed to be 4 inches of my intestine. Upon completion of the surgery, I learned that the mesh had adhered to a specific part of my intestine and caused infection, and that led to the surgery. I leave the hospital about a week after the surgery, and I noticed that I was experiencing extensive pain beyond that of what I was used to for a hernia repair. Months go by, and I'm noticing where they made the incision just above my umbilical. It was an incision approximately 4 inches long, and it went towards my sternum. I noticed there was a bulge that was starting to occur. I'll go in and have the Bay Pines VA hospital surgeons that did the surgery review the condition. And I went in multiple times. Now, the thing about this was, as I was going in to have the surgeons take a look at my incision and why I'm having another issue, they were telling me that everything was fine. The surgeons were telling me everything was fine. The pain is in my head, that there is no reason for me to even feel pain. Now, in 2019, January of 2019, I had a bulge or a knot or a bump the size of a small medicine ball It's fairly large to the point where it's distracting. I can be walking down the road and people look over and ask if I have an alien. I mean, and just trying to be sarcastic and keep things light, but curious to why I look deformed. I informed them that they're looking at a large hernia. Now, the incision that the Bay Pines VA had made gave way. The staples apparently came out on their own. The incision opened back up, allowing the intestines to go through that tear. Now, the Bay Pines VA hospital surgeons are denying that there's any significant issue and denied me treatment and had actually accused me of multiple other issues such as drug addiction. They were trying to say that I was only trying to obtain access to more narcotics. So in the hospital system, it was being reviewed that I'm only complaining about pain and discomfort because I wanted narcotics. I got tired of that. And fortunately for my situation, I am 100% disabled, which entitles me with the right to acquire treatment or care from a civilian source. Not many veterans have that luxury, because if you're only labeled at 10, 15, 20% disabled through the military system, your insurance will not cover any care outside of the VA. So if I was not 100% disabled, I would not be able to obtain treatment outside of the VA system without other insurance to help cover the cost. But what I'm trying to get at is the VA has totally washed their hands of my situation, and I currently have 5 major hernias that have resulted from the surgery in 2016 that I had with the Bay Pines VA. I have gone in and done the preparations for this upcoming surgery that I'm going to be having in February 4th. The surgery will be taking place with a civilian doctor, which is wonderful because I feel that he's been way more thorough and professional in my evaluation. During my evaluation, they have done labs and blood work and x-rays and images. They have learned, the civilian surgeons have learned that I do have 5 significant hernias. One is so significant that it requires a major overhaul, and they're only going to be able to repair that one this time. But what is upsetting to me is how the VA will not engage. The civilian surgeon, or the VA surgeon, I apologize, the surgeon from the Bay Pines VA Hospital in St. Petersburg, Florida, has denied me the treatment to get the repair done that they created. The problem that the Bay Pines VA Hospital created, the surgeons are denying me the necessary treatment to repair that damage, to the point where the surgeon himself has even explained to me that he will not be bullied into providing or doing surgery. The surgeon has told me that he will not be bullied into surgery to repair the damage that he initially created. And through that process of evaluation, the Bay Pines VA surgeon has annotated specific notes that has demoralized me and discredited myself to the point where I go to my primary care manager and he wants nothing to do with it. The Bay Pines VA pain management clinic has denied me treatment and said that my condition is far beyond their capabilities of treatment. Now, if I was not 100% disabled, I would not be able to go and find adequate care. And the most frustrating part of this is how the Bay Pines VA hospital continues to allow stuff like this to happen. I have been ridiculed and persecuted pretty much by the Bay Pines VA staff because of how the surgeon has annotated the process. It is as ridiculous. Get this. During one of the evaluations, I was at the Bay Pines VA hospital. I was going in because you could noticeably see the knot and that it was coming through. Instead of handling and addressing that condition or situation and doing the assessment for the knot that was obvious, the surgeons did an evaluation on me to look and treat me for appendicitis. Now, I had my appendicitis removed in 1987. In 2016, November of 2016, I went in for severe abdomen pain. This is at the beginning when all this first started to go south from the surgery of the surgeons at the Bay Pines VA that took place in 2016. At the end of 2016, I was in such pain that I couldn't hardly tolerate it. I was going in and trying to get them to help me, and instead of helping me, they turned it upside down and started to accuse me of trying to acquire narcotics. And that's how they started handling it, to the point where instead of focusing on the knot, now I'm getting phone calls from the mental health part of the Bay Pines VA inquiring on whether or not I'm suicidal. And in one of the notes in 2016, it stated that I actually had my appendix and that the appendix appeared to be functioning normal and was even observed in one of the images that they had taken for an x-ray. I don't even have an appendix. And the doctors continue to tell me that this big bulge, this mass of my intestines ripping through my stomach wall, the pain is all in my head and everything's just fine. But when dealing with the civilian surgeon, all my labs indicate that there is extensive infection, severe inflammation, and that my organs are actually being directly affected, such as my kidneys, my liver, and pancreas. That all my markers that indicate issues or problems that are arising were negated by the Bay Pines VA and said to be just fine. But we're learning through the civilian network that I am not fine, that I'm actually experiencing damage to my liver, kidneys, and pancreas because of how the swelling and inflammation medications that have been prescribed are affecting me as we progress through this issue. And I can't help but to think how many other veterans are out there that are experiencing similar issues and even worse. Just in November of 2018, there was a colonel who had retired from the Marine Corps. He was a combat veteran, the same as myself. He was being treated for multiple things at the Bay Pines VA. It is understood that he had been denied treatment for specific ailments that were significant in his life enough to affect and limit him in daily activities, the same as myself. And he had been denied so much for so long and had been criticized and ridiculed by the same system at the Bay Pines VA that I am. And it was so bad for him that apparently the pain and the issues that he was dealing with were so significant, he had put on his dress uniform took his medical record, placed it at the main entrance at the Bay Pines VA, and shot himself because of how bad his situation was. And there were actually 5 suicides in the year of 2018 on campus at the Bay Pines VA. Stuff you don't hear about very often on the news because it's kept pretty low key. But my point is our VAs, there are good things that come from the VAs. I mean, you hear successful stories. The one thing you don't hear about are the stories similar to my own or even worse. It's because it's not something that wants to be viewed, that the people in power wants the citizens of the United States to observe. Because who would ever join the military if they knew that when they joined or got out that they weren't going to receive medical care for the injuries that they sustained while on active duty? So it is very frustrating, and I'm just wanting to open up a channel and start talking about this to different people and try to bring more awareness, try to get the community involved so that maybe we can figure out a way of confronting the issues we have at the Bay Pines VA and all the other VAs throughout the United States. Because there are so many horrible stories as a result of bad health care from our VAs. It would be mind-blowing to those that just don't know. So if you're viewing this, please feel free to comment, share with everyone around you what you know or understand, but just don't go by hearsay. Do yourself a favor, do some reading, figure out the direction that you want to go, and let's combat this, let's confront this, and try to get our VAs to raise their standards and start treating their patients with respect and dignity and professionalism, rather than treating their patients as if they're not important. Discard them as trash and deny the treatment that they fought and earned. I mean, 22 years of military service, retired with honors, and being told that I cannot bully the doctor that is there to help me into doing his job, the job that fits his job description. I just don't get that. How can a surgeon deny a person of a surgery to repair an issue that he or she initially caused? But anyway, take care.